Welcome to the kickoff of the Colorado Resiliency Office's Adaptations and Futures webinar series. My name is Ann Miller, and I'm the director of the Colorado Resiliency Office in the Department of Local Affairs. Colorado defines resiliency as the ability of communities to rebound and positively adapt to or thrive amidst changing conditions or challenges. And we, as a state, are well positioned to put that resiliency definition into action. We are a national leader with one of the few state resiliency offices and the first of its kind Colorado Resiliency Framework, which we're updating this year. We take a cross-sector systems approach to tackling our state's most pressing challenges, and this pandemic tops the list. This webinar series will tackle pressing challenges facing our communities as we all adapt to changing conditions, and it will provide a forum for peer exchange. Each webinar will be accompanied by short tools and resources to help communities take local action. The topic of our first webinar is setting up local recovery and resiliency teams in the context of these rapidly changing conditions in the pandemic. Next slide. So a few housekeeping items before we get started. Again, welcome to everyone. We want to encourage you to use the chat function to type in any questions or comments, and to ensure that your microphone is on mute for the webinar, please. Also, this webinar is being recorded and will be posted on the Colorado Resiliency Office website, along with supporting materials that will come out of this. Next slide. We will be hearing from 4 local governments about how they are setting up their teams today, and allow time for questions and answers at the end. Next slide. So we are so pleased to have with us today 4 folks taking leads in their communities to bring people together to tackle these challenges. So we first have Gary Sankfasan. He is the co-recovery manager in Boulder County, and he is a veteran to handling fires, floods, you name it. So he's got a new challenge now. Next, we will have Laura Levy. She is the pandemic recovery manager in Larimer County. Again, a seasoned veteran on the Front Range after the floods, working in Larimer County. We also have Kathy Pagano. She's the Director of Community and Economic Development in Gunnison County. And then finally, Ann Morgenthaler from the City of Montrose and the Assistant City Manager. So we're all figuring this out as we go. So you'll get a chance to hear from these professionals about what steps they're taking in their community, and again, have some time at the end for some peer exchange. The other announcement I wanted to make is that we would like to invite all of you to join an ongoing kind of complimentary peer exchange forum that we're looking to set up. And we will be sending out a link for you if you are interested to fill it out, and we can invite you to a more informal online setting for peer exchange amongst different recovery coordinators around the state, so they can share ideas in real time. Next slide, please. We also, as state agencies, have been really working hard to coordinate our efforts to support local resilience and recovery, including DOLA, Department of Local Affairs, Department of Homeland Security and Emergency Management, and the Office of Economic Development and International Trade. All of these state agencies have regional staff that work together to provide support to your communities across Colorado as you put together these local recovery and resiliency teams. We have regional staff representatives from these 3 agencies that are on hand for the question and answer section of the webinar. Next slide. So first, on with the lineup, we have Gary Sankfason from Boulder County. I'll turn it over to you, Gary.
Thanks, Ann. Thanks a lot, and welcome everyone. My name is Gary Sankfason. I'm the co-recovery manager for our Forward Together Safely effort for the pandemic. I first want to just say this is kind of a dream come true for me and Laura. We convened a lessons learned after the flood, and one of the things we wanted to have happen was a state function convening body to help us all better and be connected around recovery and resiliency. So Ann, thank you so much for doing this, and I encourage everyone to participate in our peer exchange that we're moving forward on. So please move to the next slide. So I'm just going to talk a little bit about our history of recovery here at the county, just to give you some context, and our current structure that we have, which you'll see is version 16. So I hope that's not a surprise to anyone that we're building the plane as we fly here, and then share our lessons learned and promising practices. Thanks. Next slide. So as Ann alluded to, we unfortunately do have a lot of experience in this. I'm an accidental recovery manager. It's not what I studied and aspired to be, but I've surrendered that that's my calling now in public service. I started in 2010 and created the recovery function. It was the first recovery function in the state of Colorado. We've had now a lot of other communities join us, which is not a good thing, but we have a lot of experience. And we went through the similar economic kind of downturn in 2008, which we've really tried to capture lessons learned, but as you can imagine, there's a lot of hard knocks along the way. And so next slide. So yeah, so some of those hard knocks, some of those learnings, I just want to acknowledge that if some of you are just starting out in the recovery world, you're going to learn a lot, you're going to make mistakes, you'll have failures, and that's okay. This is all about learning and adapting. And so let me just share some of the ones that we've taken maybe 2 or 3 disasters to learn from. One is communication. We found it one of our deficiencies. You get so caught up in the moment and the response and then the recovery that you forget to communicate to your staff and to the community well. So just can't over communicate, and you got to communicate in lots of different mediums. Another one is having clear priorities. You know, we thought for the first couple of disasters that, oh, people could continue to do their prior work as well as the recovery work, but that didn't work out, and that led to burnout, and we lost some of our best staff to that poor management practice. And so now we have this 2-in-a-box approach where we have 2 people assigned to these key leadership positions. So there's redundancy, there's resiliency in our organization. Another one is clarifying roles. We took us a while to come to the understanding that we needed to really have a clear organizational chart, a clear charter, clear responsibilities and roles. Our organization is 2,000 people. It's very complex. So that's something we've had to learn. And then finally, project management, where, you know, we pride ourselves on doing great work, but we've never really applied a project management framework to this, of kind of thinking this as a big, huge organization-wide project. And now we are doing that and using those principles, goals, milestones, and measurement criteria in our work. Next slide. So as I said, I just really want to acknowledge that although we have a lot of experience in natural disasters, this is a whole complete different experience, as you all know. First of all, you know, for a natural disaster, you have a defined area that's been impacted. So you have a defined group of people you're working with, and only a portion of your staff are typically working on the recovery. In this situation, every community member is impacted. Every staff member is impacted. So this is uncharted territory. I just want to acknowledge that you're not going to have it all figured out, and that's okay. Next slide. So with that, this is how we've are currently organizing ourselves at Boulder County. Now I want to just also acknowledge that we're a large county. We have a lot of resources. and this may not apply to you, and some pieces might, and that's okay. The key is that there is no one size fits all for recovery. You need to really tailor it for your organization and how your organization culture is and your relationship with your community and your strategic priorities. So basically, the commissioners are at the top. We have a county manager, and then the leadership group of all of our elected officials and department heads who meet on a monthly basis to approve policy. Myself and my co-manager, Carrie Inashita, is the co-managers, and we have two because it kind of violates the single point of contact rule, but given the scale of this, number one, and number two, we are one of our focus areas and priorities embedding equity into this recovery, and it's really important to have a woman of color in a leadership position, which we don't have in any other roles, as well as someone who's been intimately involved in our internal equity work. So then we have a recovery coordinator who is actually a project manager. That's where we're bringing in the project manager expertise to actually manage the project. And we have three main buckets: human services, economic vitality, and operations. Operations really is about how do we reopen, and we are having 4 different tiers of reopening starting June 1st. But we will most folks in our staff will not be returning to the office in the near future, because we're really finding that working from home is being very effective. We're fortunate to have public health with us. They're acting as a consultant to our recovery. And then we have these enterprise kind of recovery teams, organization-wide across the recovery around communication, equity, engagement, financial management, sustainability, climate, resilience, and technology. And then some support services around transactional work we need for the whole recovery. And we have team leads for all of these, a team sponsor for all of these. And I said is 2 in a box. There are 2 leads for each one. Next slide. So what are some of the promising practices here that I want to share with you that I think are universal through my 10 years now working in recovery? First is appointing a recovery manager, co-managers, and I'll talk more about that. And who should that be? I've had people ask me, so should we hire a consultant who's done this before in other communities? And my response is vehemently no. You need someone who is currently in your organization or just recently left, but knows your organization well, knows your community, has project management expertise, and then can build relationships. So who else should be on that team starting up? Clearly, obviously, your city, county manager. You need your elected officials involved, your public health representatives, finance, your attorney, PIO, and other department heads need to be part of that leadership team that guides this whole effort. And then also, it depends on how big your organization is, there's a coordination element, right? There's the folks actually on the ground doing the work, they're leading the work. And so that's some kind of coordination implementation team that meets regularly, usually on a weekly basis. The leadership team usually meets in the beginning every other week, or then eventually monthly. And those team leads are key in coordinating cross-departmental, cross-functional work. So what else? What else are some of the key promising practices we've learned is, again, just having a clear organizational structure and roles so people know who's doing what their authority is. And that org chart will change, and that's okay. But as long as the whole organization knows that, that's really important. And obviously, cost tracking, financial tracking, revenue forecast, tracking staff time. A lot of this in this incident is there could be some reimbursement, but just tracking who is doing what on the recovery is really critical. And then I think it's really important to align with what your strategic plan is, your priorities, because coming out of this, this is an opportunity to accelerate those. But so just using that as your North Star in this. And then finally, partnerships, local, state, and federal, the CRO. Jim Raymond's going to talk about the DHSEM. There's just so much to be done that government can't do this alone, and don't try to do it alone. Next slide. So just quick points on the recovery manager. They're the state, one of the things we've heard from our community, and we've told the state too, you just need a primary point of contact. So the community organizations don't have to navigate our organizations. They can go right to the single point of contact. That person is involved in coordinating the internal departments. They interface with the local, state, and Fed partners. And it's really key here is that they be positioned right directly under the city county managers. They have the whole organization perspective. They're not isolated in one department or sequestered in one department. It's not about command control. This is a different environment than the EOC, the Emergency Operations Center. This is about building relationships and partnerships. Next slide. And then another, just a key learning is about taking care of yourself. We're now in the marathon phase here, right? And so we don't know how long it's going to last. This is, I wouldn't even say vicarious trauma, given that we're all experiencing it firsthand. This will take a toll on you. So what I try to share is, have a regimen, take out time. I have every Wednesday at 12 to 1 yoga. I do yoga, and I don't allow anyone else to get into that schedule. That is my sacred time. The other key part here is taking care of your staff. As I said, you can't expect your staff to do their former job and the recovery duties. You need to make this a priority. The organization needs to say, okay, this is the new priority. And given that, we need to either decide not to do some things that we used to do or find backfill staff to backfill that. All right, next slide. So just lastly, I'll just say this, we're positioning this as an opportunity. We feel like this is an opportunity to bounce forward, not about bouncing back to the old normal, but what does the next normal look like? And perfect example is telework. We are already studying policies about how do we encourage staff to stay at home and work at home. We feel seen the benefit from that already. We've seen that in terms of air quality. So this is a great opportunity for your organization to reset while also meeting the unmet needs. You got to respond to those, of course, in immediacy, but what is the opportunities we can take advantage of? So thank you. I look forward to your questions.
Thank you, Gary. That was great. Yes, just wanted to remind people that you can type in questions in the chat at any time. We are going to hold the Q&A till after the presentations. So next, I would like to turn it over to Laura Levy from Larimer County.
Thank you, Ann, and thank you, Gary. Gary and I have an interesting history of bumping into each other when things get a little rocky in our worlds, and I enjoyed working alongside of him, in our adjacent counties after the 2013 floods. And we did really learn that, as Gary said, building relationships is absolutely pivotal to both understanding what the needs are in a community and also finding the resources that maybe you didn't know were there. And that community approach is the direction that we're choosing to take with Larimer County, because, as Gary said, government cannot fix this, nor should it. This really needs to be a community-driven recovery, and during the process of recovery, any great recovery plan really should be looking at resiliency and how we don't want to just be where we were, but maybe when we come out of this, maybe we'll be stronger and better. These kinds of large-scale events, especially something like what we're dealing with right now, really unearth the fragility points within a community and the things that maybe have been swept under the rug, or the things that haven't been addressed over time, that maybe now is a good time to address them, because those fragility points tend to be the segments of the community that are impacted the most by these kinds of events. So this slide is really meant to show kind of our plan, which is like the state resiliency framework. It's a cross-sector approach where we're taking and merging our community and our nonprofits and those resources along with housing and human services needs. Obviously, this is a huge economic hit, and so we really want to have a a large force that's really focused on that, and also, of course, government and education and policy. So we've basically designed this to be a collaborative recovery group. So it's not just about Larimer County, and it's also meant to really hone in on the areas that we think are going to be impacted, not just now, but over the course of the next year or 2 years or however long we're going to be dealing with this. We know that there's going to be impacts that we can't predict, but we know that if we have the right team in place and we're doing everything to understand kind of the cascading consequences, we can prepare for those and we can be more ready for them than if we're surprised by them. So this kind of wheel is really kind of our philosophy of wanting to have a holistic community approach to recovery, where we are really making sure that we're tapping all of the best minds of our communities, and that we're connecting the dots, and we know where the resources are, and we're really understanding what the needs are, so we can build a strong recovery plan. Next slide, please. So that wheel is kind of the philosophy. This is just a very basic structure of the kind of our core team. And you'll notice that we actually, you know, because we are a community-based effort, we don't actually have the commissioners, and we don't have some of our higher levels of county government, because we're also wanting to collaborate with our municipalities and with the private sector and with our nonprofits and other community organizers. So we really want the community to feel like this is a community effort where they have a voice, and the recovery plan is the one that actually is going to be, you know, driving the boat once we start down this path. So we have the recovery manager, which is me, and then we have a deputy recovery manager who is more like a project manager, and also she's currently working in Larimer County and is acting kind of as a liaison. To back up for just a second, I actually am not working in Larimer County. I am a private contractor who has a lot of connections with community. So in our case, Larimer County partnered with United Way to bring me on board. And so I'm kind of operating, you know, for the recovery plan itself, trying to bring all of these, you know, these people and organizations together. So then we have obviously a great support system between both the county and municipalities. You know, people that we can tap that can help us pull data together, contractors. We're actually in the process of writing a recovery plan and an unmet needs study that we're going to be writing alongside of this event, so that we actually do have a roadmap for this event for the next couple of years. And then we have advisory boards, and this is, as Gary said, you know, we've basically massaged and changed this structure numerous times as we had feedback from people, and we decided that really these advisory boards were going to help kind of steer the ship and make sure that, you know, each sector had a voice in what the recovery needs were and how we were going to manage the plan. And so that's what those advisory groups are for, is really to help, you know, guide us and give us feedback. And also it's a place where people can come and kind of share their stories and make sure that we're really hearing the boots on the ground experience. And then we have, you know, 4 essential focus areas that we're targeting, and there's a chair for each of those areas, and the chair is helping us put together sector task forces, essentially, or recovery groups. And it's basically by all of the different areas of need that we think we really need to focus on and target under each of those 4 categories. Next slide, please. So these are our 4 primary categories. You can see that the chairs there. We have our Director of Economic Development, who's actually our chair of our Workforce and Business Services, and then each of the task forces that are underneath those, Housing and Human Services, Laura Walker, who is at the county, who has an incredible 40,000-foot view of all of the things that can fall under that category, including all of the agencies and programs. She's helping us design those task forces. And then community support services. Annie Davies, who's heads up United Way in Larimer County, is our chair for that group. And then government education and policy, Lori Hodges, who's our director of emergency management, is chairing that. And these are the categories that we think we really need to focus on. But what it sounds like it's an overwhelming task, but the great news about recovery is a lot of it already starts before you even get organized. And so some of these groups already exist, and it's just a matter of us plugging into them and making sure that we're capturing all of the unmet needs and the data that we need, and we're able to identify projects so that we can, work forward and make sure we get all of those in the plan. And so you don't have to necessarily create all of this. That you can actually, it's about reaching out and seeing what's already being done, and then where there's gaps, then you can create those, those task forces. And a lot of this is also, it's a little bit of a response and recovery and resiliency all at the same time, because this event, we know we're probably going to have spikes in infection. We realize that, we're going to be responding as we go this whole time. And so what are those stressors going to be in the future, and what are those shocks going to be 3 months from now, 6 months from now? How can we forecast it, and then how can we have the team working collaboratively, making sure that we know how to respond to that while we're building a longer range recovery plan? Next slide, please. So this goes back to the advisory groups and how why we basically went to 3 different groups. We actually started with more of a traditional long-term recovery group template, which is built for disasters, which works great. But as Gary said, that's usually in an isolated area, and normally the agencies that respond and the volunteers that show up, FEMA, all those things are kind of pre-programmed into a template. That we know how to do that because we've had disasters. But this was so large and so broad sweeping that literally every single one of us is both impacted or affected, and we're responders, and we're working in recovery, and that's everything from locals all the way up to the federal government. So when we were building our executive team, we found that so many people wanted to be on that. It would have been a very large group that would have been a bit unwieldy. We decided, really we didn't need an executive team because we were not managing a large pot of money the way a long-term recovery group may with donations. We aren't necessarily managing big teams of volunteers. So there's a different structure that's needed here. And we wanted to make sure that all of those leaders at every level of government within our region, and all of the private sector businesses, large and small, and everybody in the community really had a voice and could help guide us. And so that's why we divided it up into this approach. Next slide, please. So as Gary said, we really feel this is an opportunity as well. And in Larimer County, we've actually done a lot of planning work, and we've done our own resiliency framework. We were involved with the state when they built theirs 5 years ago. We look forward to being part of that conversation as they update it for this kind of an event. We've also done a fragility study and an unmet needs study in the past. We have a hazard mitigation plan. There's a lot of work that's already been done, and it's really good to basically look back and make sure that your recovery plan is incorporating some of those things that years ago you've already planned and identified as needs, and you incorporate that. So a good recovery plan, essentially, we're going to be collecting data, assessing what the baseline is in terms of where Larimer County was before this happened, and then what happened during the part of the event, and then what are we forecasting, and how do we track what we're going to need in the future. And so these are just the quick kind of initial phases that we're working on. Right now we're just starting to convene the groups, And I'm getting a question asking how the task forces and advisory groups work together. The advisory groups essentially are going to be communicating what the kind of global perspective is in each of their sectors, and then that's going to be heard by our kind of core recovery team, which is comprised of everybody you saw on the org chart, including the chairs of each of the focus groups. And then from there, as we build out the recovery plan, we're going to be identifying projects and making sure those happen at the task force level. So that's essentially how they work together. And at the same time, we're also wanting to create kind of an overarching value system of what's really important to us moving forward, so that is layered within everything that we do, and that's equity and inclusion, resilience planning, making sure that there's connectedness within the community, making sure that we're fostering stability. All of those things we want to make sure are woven into the intricacies of our plan. And building all the communication systems and networks. We're very fortunate that we have been, you know, it's the silver lining of being through disasters is that a lot of the same people know how to work together, and we kind of know where those resources are. So we're just building that up. So if your community hasn't had that kind of experience, this is a really good opportunity to build those networks and keep them going, you know, long after this is gone, so that you can call upon them when something happens again. So right now we're kind of in that first phase of recovery planning. Then we're gonna write our recovery plan and unmet needs study, which is really key to making sure that you understand the big picture and that you can convey it as funding opportunities come, that you have, you know, the projects identified and it's well written and well presented, so that you have a good shot with the fundraising opportunities, and also that you're connecting the past projects with the present to create an overall plan. We don't need to reinvent the wheel. You know, a lot of the work has been done over the years, and we want to make sure that, you know, that we're looking to that. And at the end of the day, we're looking to be stronger and better than we were when we began, and maybe to address some of those systemic fragile breaks in our community that have needed attention for a long time, but it took something, you know, like this magnitude of an event to really address those. So I'm really looking forward to working with our community on that and the greater recovery community, and to again express what Gary was saying. You know, we really look forward to also collaborating with all of you as you move forward, and welcome you to connect with us. And I sure welcome you to connect with me, and because we have a lot to learn from each other, because nobody has been through something like this before. So thank you.
Thank you, Laura. On to the next presenter, Kathy Pagano from Gunnison County.
Good afternoon, everyone. I'm Kathy Pagano. I'm the Director of Community and Economic Development in Gunnison County. And most recently, at the end of March, beginning of April, have been assigned as the recovery lead under our incident command structure. Doubling up a little bit on current duties, as the previous presenter from Boulder County advised not to, but in this interim initial phase, that's what we're doing as a community. Next slide, please. And so I just wanted to kind of go through a little bit of our background. We had our first public health order on March 14th. Gunnison County was one of the hot spots in the state. And so we stood up an incident command structure in the middle of March there, and included, of course, our public health director, emergency operations and management folks, and hospital staff. And then as we proceeded a couple weeks in, the municipalities and the county and incident command team began to discuss including recovery as part of that incident command. So we included recovery beginning at the beginning of April. And I'm the lead for that, but we have taken a collaborative effort for the recovery team, and we've included planning staff mostly from all the municipalities in our county. But we've also included staff from our Health and Human Services Department and another healthcare professional on that staff. Similar to Larimer County, we have 4 focus areas that we're thinking about for recovery. That's businesses, for-profit and nonprofit are included there. Our health and human services sector, so those individual and community needs, those equity issues, and how are we assuring food and housing security. And then government infrastructure, excuse me, and civic organizations, including the school districts, our university, and others. And then finally, we've also been talking about medical providers and how can we ensure that they continue to be sustainable going forward. Next slide, please. So this is really hard to read. This is our recovery structure. So we have incident command at the top, and then we put the recovery structure under there, but we've done something a little bit different. We've previously instituted a group called the One Valley Leadership Council. That group had spearheaded a prior planning effort called the One Valley Prosperity Project that focused on regional economic prosperity and community prosperity in the past 4 or 5 years. And that group is made up of leaders throughout our community, from the county, elected officials, municipalities, and staff, but also our school district, the university, Crested Butte Mountain Resort, our community foundation, and other institutions throughout our community that really exhibit a leadership role. So the recovery team is working with Incident Command, our elected officials, of course, our Board of County Commissioners, and the One Valley Leadership Council to identify not only tactics and strategies that we need to address on a near-term basis through Incident Command and public health orders and questions, but what are the policies and collaborative efforts that we as elected and policy makers need to address going forward that are outside of Incident Command. So on our recovery team, again, we have those 4 sectors, and then we have each individual things under there that we're addressing specifically. Next slide, please. For us, the recovery team effort has been critical that it be collaborative because this is such a huge effort and there's so many moving parts. And as you all know, things change on what initially seemed like a minute-by-minute basis. Maybe it's hour by hour now, but things are changing dramatically all the time. So we have found this collaborative effort across jurisdictional boundaries to be working well for us, so that it reduces the workload and capacity demands on each entity and builds upon those networks and relationships. And, I want to say that we've had challenging relationships before, just like many other places, between municipalities and the county. But through this pandemic and a coordinated collaborative response, we've really been able to build on and solidify our relationships so that we are really working in a collaborative way together. And I think that has been very beneficial for our community. We are utilizing some volunteers as part of the response and recovery effort, but also paid staff has been an important part of this. The reprioritization of work for the year, because we have not previously been through something like this. We haven't had any major natural disasters in Gunnison County, knock on wood, in the past 20 or so years, and so we didn't have any kind of recovery manager in place already. So right now we're working with an existing staff, but we are beginning the discussions of what does long-term recovery look like, and what would a recovery manager do, and who is that person? And it's likely not going to be me necessarily, because I already have a job. But for now, we are reprioritizing our work plans for the remainder of the year, with input, of course, from the county manager and our board, to focus more on this and less on some of the other things that we had planned on doing. And we have found that building upon existing networks and existing relationships has been critical for our success and for our recovery. And success is probably too strong of a word, but for our collaboration and moving forward. Next slide, please. One of the things that we have been doing, fortunate to have a group called the ICE Lab in our community, and ICE Lab stands for Innovation, Creativity, and Entrepreneurship. and it's an incubator and accelerator facility that exists at Western Colorado University. And at the outset of the pandemic, the ICE Lab initiated business sector groups to meet on a weekly basis to try to answer questions, to resolve issues that came up, to identify gaps and needs that local government may be able to address or others in our community. Those have been really impactful from the perspective of helping to support businesses, engaging businesses. We have, we're a pretty small community of about 15,000 people, and we have over 900 folks subscribed to those sector groups. And they may not all represent exactly a unique business, but certainly a lot of engagement there. And so those have been really helpful in understanding the needs of the businesses, helping respond to those needs, and then engaging them as we continue forward on recovery and resiliency and figuring out how we might move through this and out of this in the next several months to several years. And they have also had a back and forth feedback loop with the public health director. She has participated in some of their sector group meetings as we discussed reopening plans and what that might look like. And so that has been helpful for, I think, for them to have a place where they have a direct line of communication with our public health director to understand, to hear from her why she's making the choices that she's making, and also for her to hear from the business sector how those things impact them individually and on a sector level. So we will continue to have those moving forward, and those will be really critical in our recovery process as we think about how does this shift our economy, how does it change for us, how we go about doing business. We are a very tourism and construction focused economy. Much of our income comes from those two sources, and of course those are very impacted by this pandemic and by fluctuations in the national and global economy previously. Next slide. So we're considering mid and long-term recovery, and as I mentioned earlier, we have a group called the One Valley Leadership Council that's a collaborative group, and they have been focused on long-term resiliency and recovery planning. We're working with an organization out of Glenwood Springs called Community Builders, who we've worked with previously and who works with communities across the Mountain West to develop a scope of work and plan for this mid and long-term recovery planning. What I think is unique about this event compared with a flood or a fire is that we don't have an end date. The event is still ongoing, and so that provides challenges for how you begin to think about recovery or resiliency planning. And for our community that is, very focused on tourism and visitors, I think there are some challenges associated with that. And so as we think about resiliency, we may want to consider how we can elevate other sectors of our economy at a faster pace than previously we've done. And so that will impact how we, consider the tourism economy. And so those are challenging conversations to have. And what we're trying to be really mindful of and sensitive to is, where's our community at? Are we ready for those conversations? Some of those are difficult conversations, and right now folks, I don't think, are ready for some of that work to be done yet. So we're working through that and trying to be sensitive to that and think about how we might broach those conversations and get that input from our community on what does resiliency mean to us, what does it look like in the future, and what does our changing economy look like, and our new normal or our next normal look like for our community. Next slide, please. So this is just kind of an overview of what we're doing this summer. Right now we are working on some strategic planning and scenario analysis. I just got off an hour-long call with our recovery team, walking through different scenarios for various issues that come up through this. So scenarios around economic conditions, around the public's willingness to comply with various public health orders, and of course the various scenarios around the pandemic and how that will shift and change over the months. So we're working through that. We're also doing some survey work. We're doing business survey work and a community survey. Our first business survey came out about 2 weeks ago. And we have a community survey coming out next week. And those are to gauge the various impacts across the board, and to have an outlet for folks to be able to vent some of their frustrations, questions, concerns about all that is occurring in our community. As part of all that work, we are going to do a vulnerabilities analysis also to really understand, where the vulnerabilities, and I'm speaking specifically to populations in our community, where those exist, how those are being exacerbated right now, and what the challenges are there that we might be able to address. And then continuing with communications and engagement work. Engagement work with the general public is certainly going to look vastly different in the coming months than it has previously. So how will we be able to engage the public and understand where they're at and get feedback from them, but in a way that is compliant with our public health orders. Next slide. So phase 2, our long-term recovery strategy, is about defining resiliency for our community. When we did our previous prosperity project, we defined what prosperity means to our community, and that was really compelling and a meaningful exercise, and gave us some real guideposts for how to move forward. So we'll be working on that in the coming months. We're looking at starting in the fall for this work, but again, as I mentioned before, being kind of sensitive to where we're at in the community. If there's a resurgence of the virus in the fall, that may not be the right time to start this work. But we'll continue doing that public outreach and figuring out different unique ways to do that. And then creating strategies and goals for a recovery plan and a resiliency plan. And then, as we did during our One Valley Prosperity Project, creating an action plan that identifies metrics for success, who's in charge of what tactics and strategies, and when they're expected to be done. So that's where we're at in Gunnison County. It certainly is a challenging time for all of us, and it's great to hear some other ideas. I appreciate hearing from Boulder and Larimer and some of their ideas. I'll be taking those with me today. Thank you.
Thank you, Kathy. I echo this wonderful opportunity for the peer exchange. And with that, I'll turn it over to our final presenter, Ann Morgan Thaler from the City of Montrose.
Great, thank you, and thanks everyone. I've learned a lot. I'm Ann Morgan Thaler. I'm the Assistant City Manager for the City of Montrose, and I know we're getting short on time, so I'll run through my information quickly, but I hope you'll contact me if you have any questions. So we're the one municipality here on this presentation, and so we're a piece of the puzzle that you've been seeing in the other counties, and we've been working with our county very closely through this entire process, and we'll continue to do so. And I would just echo what Kathy just mentioned. I think over time in Montrose County, there have been communication challenges between the city and the county. And this has actually been an opportunity for us to work really closely together. And we're thankful for all of the relationships we've built in the community up to this point, because they've been really valuable. Next slide, please. So this is where Montrose is located. In case you haven't been to visit us yet, we're in southwestern Colorado. Next slide. And at first we were adapting, like nearly everybody, but again, as Kathy mentioned, and we heard from Boulder County, it's probably not advisable to keep doing everything and work on recovery at the same time, but we needed to. So we were continuing to provide city services, and we still are. And an example of why I think that's really important is that when we shifted, we didn't really know what this was going to look like. So we started working from home, and we knew it was important to provide our community the services they were looking for and give hopefully some continuity to those services, especially in building and planning. Like Gunnison County and Montrose County, and in the city of Montrose in particular, we really rely on construction. And we need for that to continue for the jobs and for the industry that it provides for our community. So there was a bit of a rush on building permits right when COVID started happening, I think because there was a fear that our building and planning services were going to shut down and no one was going to be able to get a building permit. And to the contrary, we kept those services going, and we've actually been able to improve on those services by providing more electronic formats of communication and permitting. We really focused on communicating and listening to the public. We set up a website or a web page immediately on our City of Montrose website to share information about what was happening. People were hungry for information and things were changing quickly, so we tried to keep up there. We, as I mentioned, relied on our relationships that we had built in the community, and we took on new roles. So we didn't have an emergency manager here within the city, but we have a lot of capable staff members. And so suddenly our job shifted a little bit. We have a community engagement specialist. Her role at the time before COVID was not to coordinate meal delivery for our community, but suddenly that was a gap that she needed to fill. And that happened across Montrose. So we saw our rec district stepping up to deliver meals that were provided by the school district. And we saw the Boys and Girls Club participating with that. And it just was a really excellent time for us to come together. And we anticipate we'll keep going that route. And we think that adapting in these ways, doing these new things, is laying the foundation for credibility in our community and also to support our community in the future. Next slide. So this is something that we did at the city level. The city organization has strong ties with our business community, stronger than our county did, and that's just the nature of our local government. And so our city council directed us to quickly take action to help our businesses. So these are 3 examples of things that we were able to do in really short order, thanks to our city council's guidance. So Montrose Small Business Emergency Loan Fund. We had some funding reserved that had been allocated for a different use, and we decided, our city council decided to use it instead for these business loans. So there's information there about those, but I think that's an example of reprioritizing and adjusting. You know, we had plans for what our 2020 budget was going to look like, and it's going to look a lot different. Even if we are fortunate enough to get close to the same revenues as we anticipated, and we'll be using them differently. Sales tax deferral, I know a lot of communities have done sales tax deferral, we did as well, and also cooperative marketing grants. We had money budgeted for tourism marketing and elected instead to use it to support our local businesses directly and encourage them to partner with other businesses on marketing efforts, and we would give them a $1,000 marketing grant in order to do those efforts. And we've had great partnerships come out of that. So an example is an auto glass company, an auto shop, and a towing company are partnering on some marketing. Also, we had a surgical center, a urology clinic, and a women's clinic partner on some marketing. So we felt like it was more important right now to use our money in this way than in the other marketing efforts that we had planned. Next slide. And then challenges and opportunities. Of course, there are lots of both, and we heard great examples previously, but of course, as we continue on this recovery path, I think we're all balancing having our communities be open and also respecting public health priorities. In every community, there are changing realities and varying perceptions of the degree of severity of this crisis. I think that is something perhaps different than in a flood or a natural disaster where people have more similar perceptions of the crisis. Here in our community, we see some people who really think that this is severe and advocate for the strongest precautions. And then we have people who think that it's overblown and that our community should be totally open. So that's a day-to-day challenge that I know we're all navigating. And I think we'll just continue to put our skills and training to use. A lot of us have prepared for this without knowing that we were as local government staff and leaders. And even if your community doesn't have a lot of resources, it seems like there's lots you can still do to communicate, express support to businesses, to community members, and as was mentioned, perhaps be more of a convener to get together the other partners in your community who can also take action with you. We found that to be really useful just regionally as we start to talk about tourism, to realize that we really are all in this together, and what affects one of us, one of our communities affects us all. So we started talking with URA weekly, bi-weekly, in order to talk about how we'll approach tourism and sharing common messaging up and down our corridor for travelers. So that's a quick rundown, and I look forward to your questions. Thank you.
Thank you. That was amazing to hear all the innovative approaches and collaborative efforts that are happening as we figure this out as we go. There's no one right approach. And I want to acknowledge all of the challenging times that all of us on this call are in the midst of providing leadership and helping our communities solve problems in real time. So thank you to all the presenters for sharing your community's approach, and for all those on the phone that are also navigating through this and crafting your own solutions. And we look forward to hearing from you. Given that we have just 4 minutes left, I may just ask the panelists, and if any of the state regional staff on the call would like to chime in with a quick, very rapid final tip that you would give, your top tip that you would give communities that are on this call as they build their teams. What do you think are the kind of the biggest, the top advice that you would give them? I'm going to start from the top with our first presenter and ask Gary to just maybe a sentence or two, and then we'll go in order, and then we'll give the opportunity for any of our state regional staff to give their tips as well. Gary?
Sure. I think just having again, recovery manager is critical. Someone who is a point person for your effort, and then your leadership team, convening that leadership team to develop your kind of plan, and having a plan, and not knowing the plan will change, but having a plan for moving forward, long-term recovery. Thanks.
Laura?
I think the number one thing to really look for is what you already have in front of you and you may not know it. So making those connections both within your own departments and understanding what information they already have, what the needs already are, who is already meeting, who's already coming up with solutions, and making sure you really understand that, because this can be really overwhelming, but fortunately many of the answers sometimes are already right in front of us. We just have to connect the dots and find them.
Kathy?
I would say a collaborative approach, and so utilizing, all the resources and assets that are in your community, from the private sector to the public sector, and everything in between.
Finally, Anne.
I would just add, I think it's important to prioritize, and it goes along with everything that the presenters just said, but we actually, I think, all do have a lot of resources at our disposal, but it may mean using them differently as we move through this.
And I'd open it up to any of the state regional staff if you have any tips you'd like to add as we close here.
Hey, Ann, this is Patrick Rondinelli. I would just say communicate, communicate, communicate. Every incident I've ever been involved in, the number one when we do the debrief afterwards is communication, and just keep that in mind. It won't be perfect, but make sure you're talking to your stakeholders, you're talking to your partners. You got to develop and bring those relationships in closely to be successful, but make sure you're open communication on it, because in some cases over communicating, because that's where problems occur, feelings get hurt, but keep your communication open with everyone.
All right. Thank you all for taking time out of your very busy schedules to share and learn from your peers. And we look forward to continuing this conversation. We have, as I mentioned, a webinar series. We have our website where you can go to for information and to learn from your peers across the state. So more to come on that. You will receive an email tomorrow with the PowerPoint presentation and some other materials and resources, and more information on the upcoming webinar series. 2 weeks from today, we'll be back again for Budgeting Strategies for Challenging Times, our second webinar in the series. So thank you all, and a special thanks to our wonderful presenters. We look forward to our next time together. Thank you.